All right, Joe, welcome to the Biohacking Beauty podcast. A true pleasure because I've been following you for a while.
Yeah, thanks for having me.
Yeah, definitely. So the reason we're having you on is mainly because as Young Goose grows and we're talking about those, the things that I would say really determine the way that your skin looks, either determine how your skin got to where it is now, or are driving it to look its best or its worst in 10 years, are most of them are misconceptions. So we're trying to have people such as yourself on and really give people an outline of what they can do to improve their health and their skin health in the most profound way. And I think, a good question to start with, I do it often, but I think within the health space, there are two types of people. The first type of people are people like me who are just ridiculous nerds and just get into it because you can make a difference. But most people have gone through their own health challenges and kind of found a way to deal with them and are now sharing with others. So would you like to tell which one you are, even though I know the answer?
I'm actually both.
Okay.
So ridiculous nerd and also had a lot of health problems. And so I'll give my backstory a little bit. But basically growing up from a relatively young age, I started to have a lot of health problems one at a time: brain fog, fatigue, gut problems, just joint pain, whole bunch of different issues, motivation. It's just across the board. Skin issues, acne, I started losing my hair, like male pattern baldness at the age of 13. It was just across the board of like whatever, I actually didn't have like some of the metabolic problems that most people have. Like I wasn't obese or anything like that, but I had a lot of the autoimmune type issues, and from a pretty young age. And there's other people who have some of those issues that have become somewhat well known, like Jordan Peterson. Yeah. He's got like these autoimmune issues. But for me, my autoimmune issues actually hit the hypothalamus and a bunch of other places. And the hypothalamus is like the control center in the body. And so I had a lot of problems, and I had to figure out, at a certain point, I was disabled from these health problems. Means I couldn't do anything. I couldn't date. I couldn't live a normal life. I was antisocial. I couldn't go to school. I couldn't work. Just completely disabled from life.
Wow.
Yeah. And that was like the rock bottom, I would say. But I am an extremely inquisitive person. I'm very open-minded, and I'm also very skeptical. And I would say, I have pretty good logical reasoning. And so I think the combination of those, I was able to really come to certain conclusions that gave me a framework with how to solve my problems. And I initially started with, going to some doctors, and it was very clear. I was actually poor as well, so I was on Medicaid at the time. I went to some doctors, and it's like, first of all, I can't even afford some of these other doctors, but I like going to these. But I've met other good doctors in my life, and I saw that they didn't really know the answers to my issues as well. So it wasn't just a shitty doctor problem. And I see that today, right? I have two brother-in-laws who are good doctors, and they don't know anything about how to fix any of the health issues I have.
Within that, just a short intermission, like I remember giving a talk in master class in dermatology pre-COVID, and I got to meet the head of dermatology for Harvard. And again, 2018, I'm asking her, and she is an itch specialist. Okay. So she was talking at my friend's booth about psoriasis and eczema. And I'm asking her, well, when you treat, because she's also, actively treating patients, seeing patients, do you check their gut permeability if they have a leaky gut? And she could not think she thought I'm an alien. She had absolutely no inkling to ever do anything like that. She's like, no, I have 15 minutes. I see them. I give them whatever they want, basically, and continue my day and never think about them again. So it's not a shitty doctor situation, because this doctor literally is at the pinnacle of someone who's going to have an autoimmune issue.
Exactly. And so it's not a bad doctor problem. It's just that's what the conventional doctors were. And I was always a skeptical person. I still am. And I never, I knew some naturopathic doctors and how they worked. And my family had a background in like health and naturopathic. And, my mother already tried vegan diets 40, 50 years ago, right? So my family was always very into it. My grandmother was trying Atkins when they came out. So it's like my grandmother was trying different health stuff in the 1950s. This is like almost genetic. You know what I'm saying? I come to school when I'm like 12 years old or 10 years old with I had like whole wheat bread, sperm, what was it called? Sprouted whole wheat bread with tuna fish and like lettuce. And I was the only kid in school eating that stuff. And so it was very weird that I had all these health issues. And so, but I had this health background, and I kind of realized that I didn't believe the paradigm, the alternative health paradigm. They were doing like muscle testing. I'm like, no. Like that's not my thing. Or, and by the way, I tested it out. I said, okay, like, I'm going to hold this container. I'm not telling you which one I'm holding. You tell me if I'm weak or strong, and I would do, and they wouldn't be able to predict what what it was. And so I was like, okay. And I just didn't think that it was clear that, these alternative medical doctors didn't really know what was going on either. So then I turned to the blogs. The early blogs. There was I've been doing ice baths since 2007.
Wow.
I've been into intermittent fasting 2007. So I've been in this field for a long time before any of these fads became big, and so I've gotten see it over time. But so I tried all these things a long time ago, and I've been experimenting on my body for a very long time, and. But what I was doing for a certain stage was just trying to follow other bloggers and see, because, and what I realized is every blogger is basically saying, this is the magical solution. It worked for me, and now it's going to work for you. So I tried what everybody said, and actually none of it worked for me. So it wasn't like I found my guy who's working for me, and then I could just follow everything that person. None of them worked for me. Everybody
found another guy that their system did not work for you.
Exactly. So everybody I tried, their system didn't work for me. And then and it's very easy to see that you can have, 1,000 gurus, and each guru is going to contradict the other guru, right? And say that their system is right. And so it can't all be right. And then the problem with the functional medicine space, the alternative health space, in my opinion, is if you go to a Lyme doctor, they're going to tell you have Lyme disease. If you go to a mold doctor, they're going to tell you have mold. If you go to, you name it. I've been around the block for too long, and it's like, which doctor did you go to? Oh, let me guess. They told you had this, right? Adrenal fatigue. And so I started to do research on all these things, and it turns out that adrenal fatigue is completely bunk. It's not, it doesn't mean anything, because all the symptoms of adrenal fatigue are not from problems creating cortisol. That's from the hypothalamus. So it could be something like hypothalamus dysfunction. But what I saw is that there is a complete lack of understanding of basic science in this alternative space. So there's an open-mindedness, but a lack of basic science. And on the other end, there is just, there's no care of nutrition or anything outside of drugs to treat anything, which both of those paradigms didn't work for me. Now we're in a new stage where I'd say there's more people around that, they're not one or the other. I would say maybe like a Peter Attia and Andrew Huberman. These guys kind of fall somewhere in the middle, which is why I think they have such a big following, and they also have good credentials. And so you have people like these around, and some others that are basically like, okay, they're not quacks, but they're also open-minded. Maybe they have different specialties. I wouldn't say any of their specialties is supplements or anything like that, or precision health, actually. Peter Attia, a little more on the precision health. Andrew Huberman doesn't do precision health at all, as far as I understand. Peter Attia more, but I wouldn't say he's the most, advanced there. But
he's also, as far as his character isn't an early adoptive character whatsoever. So that is definitely, he'll fit certain types of people. But if he'll talk to me, for example, about, cholesterol or things like that, it wouldn't resonate, for example. So even though he is someone who is interested in the space, I believe like his flow of discerning what information is applicable is a little bit different than I believe maybe most people who are in that space, which are still somewhat early adopters.
I think his focus is a little different. He's very much focused on clinical things, a little more focused on drugs, less focused on supplements. He doesn't really know about supplements, and I think he's pretty honest about that. He actually does recommend Self Decode as a genetics product. He looked at a bunch of them. I don't think he fully understands, like he doesn't even understand the full extent of how much crap is out there and the difference. But even with what he knows, he still picks Self Decode. But besides Peter Attia, I have a very different approach. It's not quite Peter Attia. It's not quite Andrew Huberman. It's my own formula, really, of how to really get good results. And I've used this approach to get excellent results. And my mission is really to make this into software, which is where Self Decode comes in. How do we make it so that somebody doesn't have to have my level of knowledge? They don't have to have 20 years of doing mega dosing experiments on myself and, all this time spent and on doing everything, right? How do we make it the most efficient process for an individual to understand how to be healthy, prevent disease? And so I always had my paradigm of what was needed. And that's what I've been working on for the past 10 years. And it's like, so first I started out with a health website. It was called Self-Hack, and that got a lot of views. And it was basically publishing articles on like the benefits of supplements and different things like that. But what I realized is there's limitations there, because people were just like, okay, well, this is good, but how do I know what the hell's going on with me? Which is a good point, right? Like, how does this relate to me? And so I quickly realized that, and I had the same realization that I could understand a lot of information and try to put some pieces of the puzzle together, but how do I know what's applicable to me? And so I started to think about things in that way of, if some guru said this works for me, I was trying to think, why would this work for them and maybe not other people? Why does a vegan diet work for some people and not other people? Why does a paleo diet? I think some of it, they might not realize what's exactly working for them, but I do think that there's certain genetic predispositions to either do better with a vegan or a paleo diet or something like that. Low carb, high carb. So that's kind of what I realized is there needs to be a combination of self-experimentation with data. People have to make data-informed decisions, and that's what I did. So there was two phases to my health improvement, actually. One is where I looked at a little bit of data. I had some lab tests. I looked at a little bit of data, but it was really focused very much on trying to get as much information as I can and experiment with everything that I can under the sun. And that led to some improvements, because if you do enough experiments, it was very time consuming. I basically didn't work for like 2 years just doing experiments myself.
I'm assuming also pretty expensive.
Expensive, and some things you got side effects from. Yeah. But I learned a lot, and it helped me a lot too. It was actually a decent approach in, if you just, try everything, you'll eventually get things that work for you.
Yeah.
And so I would say that in my life, there's been two big periods of massive improvement. One is that initial period where it's like I took a lot of the information that I gained over some time. I just experimented with everything, megadose experiments on everything that I could get my hands on, every supplement, every diet, every lifestyle thing. And, and that took a lot of time. And then over the years I kind of started mixing it up a little more. I kind of did a hybrid approach where I was getting some data, doing some experiments. And then I would say that there was a little bit of time where I kind of cooled off a little with my experiments and data approach, was more focused on building the product that I know needed to be built. And then I would say a year and a half ago, 2 years ago, let's say, was the next big improvement, where that's when I started to use the data to make better health decisions. Like I'm much more focused on data rather than the megadosing experiments.
Yeah.
So I still did some, but it was more making decisions based on data, and that had massive improvements. So each had their own massive improvements. But the reason I stopped with the megadosing or slowed it down is because there were side effects. And, if the only way to figure out is megadosing and there's side effects, I'm like, look, I'm healthy enough at this stage. I think I could slow it down, or I could try things more over time, or do it in a little more of a relaxed way, which is what I did. Maybe try to do, include some data. And so there were improvements. There were slow and steady improvements over time. But I would say 2 years ago, I came to this conclusion that I have all these tools at my disposal, and I have all this knowledge. Why am I okay being like, a healthier than average, let's say? I fixed most of my health issues. If you look at me next to a population, I was pretty damn healthy, maybe in the 95th percentile. But what I saw is like, why am I not in the 99.9 percentile, right? Mm-hmm. And so that was the next conclusion, where I said, I don't want to just be like above average healthy. I want to be the healthiest guy around. That was the next inflection point in my health, where I said, yeah. And the difference, by the way, is, let's say before, if I exercise too heavily, I would get sick. I would just say, okay, this is just, I exercise too heavily. Live with it. This new approach was, wait a second, but there's, some of these mutants out there, they can exercise 7 hours a day and not get sick. Why are they not getting sick, and why am I? So I'm comparing myself not to the average, but to the mutants of society, the people who have really great genes, or really great whatever. They're doing, usually great genes, and they're probably reasonably healthy as well. So that was the next big. And so I said, okay, in order to make this change, I need to really start getting in a lot more data, really doing more analysis here. And I would say that was a massive, massive game changer, more than I would have. I'm always surprised at how big of changes I made, like in hindsight, to be honest.
Yeah.
It's like, wow.
Yeah. I mean, it speaks a lot to kind of what we're talking about when we're talking about skin health, because there are many approaches to looking your best. Obviously, the most simple approach is just, let's take good care of ourselves, eat correctly, not have a lot of inflammation in our body, supplement to our deficiencies, and, use good skincare. But you could use strategies that we know, whether it is, lasers or whatever that is, to look better. But now we need to make sure that we are those mutants that react to those treatments in the most, in the most effective fashion, whether it is recovery from them or, collagen production or whatever that is. So I completely understand what you're saying when you're talking about exercise, because that is just another organ in your body that you're targeting, basically, for optimal performance, if you would. Okay, so that was you getting the best data. Do you think that the fact that you can draw on other people's data contributed to what's working for you? So the fact that you have big data to draw on and see what works to a larger population also helped you, because now you don't have to megadose everything under the sun, you kind of know what would be probable to help you the most.
Yeah. So now if I had the technology, meaning if Self Decode was out, I wouldn't have gone the megadosing route. I could really have figured out what was going on without megadosing and see what works for me before, without doing all the megadosing. So I would just take the data approach right now if we had the software available. And in terms of your question, I would say that when we, when we validate our genetic models, it's against databases of 2 million people. So I wouldn't say that that's helping me directly. It's more helping the product be more accurate in terms of getting predispositions. But yeah, I think the amount, as the product gets better and more advanced, my health just improves in lockstep with that. Because I'm the first user. Like, I know I'm involved in products, so I know what's going on, and I can see what's going. And so I'm using the product very heavily, and it's just the results are incredible. And I can explain exactly, what that process looks like. But the results are really, I've been able to get rid of all of my health issues, and on pretty much every matter, I'm able to, like, if you look at my pace of aging, it's lower than Brian Johnson's, right? My VO2 max is better than Brian Johnson's. Whatever marker you look at, I'm better. I feel like I have more energy. People are tired out. I'll do 4-hour workout, no problem. Whether it's acro yoga or volleyball, whatever it is, everybody else is getting winded much before me. And so when I look at all of these, and in the past 7 months, I would have gotten sick so many times. There was so many infections going around. I really so I noticed that my body was fighting infections. I would say that I haven't yet. I'm going to try now to get more into that, but I haven't figured out how to not get an infection, meaning somebody breathes in an infection or you share germs with somebody sick, you're going to get it. But what I have figured out is how it won't affect me in any significant way. So I just continue with my life, and I'm not significantly affected by it at all. Very, very little symptoms. So that's kind of where I'm at now. And there were 7 infections that I got in the past 7 months that I didn't get sick from.
Wow.
And this is all from the data. Without the data, I would never have been able to figure this out. Yeah. So I can explain the framework, if you'd like, of how I go about with that.
That's my next question. What I would like to understand is, you piqued my interest when you said as the product gets better, but if you could please, let's break down what Self Decode is, because I think there is a lot of information that I would like to learn about what differentiates it. But first, let's figure out, what exactly it is so we can understand differentiation.
Okay, so Self Decode is the most advanced platform by far to get personalized recommendations that will improve your health and prevent disease. In a nutshell, that's what it is. It's a software. We use AI in a bunch of different areas, but essentially it's to get what is the recommendation that's most likely to work for me. And everything is backed by data. You can see the whole data trail, all the references. It's all there. We have studies submitted, patents pending. We have all the references. There's hundreds of thousands of references on the site, going to published journals, supporting every statement that we make. So, and then there's algorithms, really very nuanced, that go into what recommendation is prioritized for each individual. So that has been my passion forever. And the reason is because it's always been, why am I sick? How can I help other people? I don't like zero-sum occupations. I like things that I can help myself. I can help other people, win-win type stuff. And so health has always been that kind of field. And I've always been allergic to kind of making a product that's like, it has some value, but it's not there yet. You know what I'm saying?
Yeah.
I always have that complex of like, it's not there yet. Got to make it better. Got to make it better. Got to make it better. And so, and the reason, and in this field, that's like very hard to do because the human body is so complex. And so when you are trying to take in as much data points as you can, that becomes a very complex thing. Now, it pains my heart, but I'm used to it at this stage to see all the other genetic companies in the space pretty much are snake oil.
Yeah.
Meaning what they do is they're selling, and I'll explain what the difference is, but they're basically selling a couple genetic variants. For us to build something like that would be like $10,000, and it's just a marketing and sales pitch at that point, right? You just get the marketing, the sales team, and that's why there's a new company every day in different niches. I'm trying to change that based on education, but it's people don't understand. I think there's a lack of understanding of genetics, of how people can improve their health, and hopefully people will understand my approach and how that works. But
I think just to stop you to make sure we understand, this is a good touch point. The financial touch point, I feel like, is a good touch point because everyone, I would assume, has things in their lives where they understand how more money would make it, whatever it is, better. So it's a clear point. Why would somebody invest 10,000 if they can instead of 20 million? That's understandable. But what makes, a $20 million investment more impactful than a 10,000? What is there by increasing investment?
That's the problem that I am facing, right? I have all of my competitors. I literally built the product 10 years ago. That is what they're selling now, 9 years ago, whatever it is. And I've been spending, like I said, $20 million to make it what we have. I could have just stopped at the 10 grand, sold a PDF of, 100 snips or whatever, and, just had a marketing and sales force behind it and sell the shit out of it, right? And then just focus on sales and business development, not focused on making the product better. Instead, I always focused all the money on product development and not sales, with the hope that people will eventually see the difference. But I now understand that people, they in some ways they can see, when you see the product, you see how rigorous it is. And, we have the papers and all that stuff. But still, at the end of the day, it's like the sales pitch is still hard. It's like, how are you different than this company? And look, I'm just like, this other company's a complete scam. I got to go into a whole 20-minute explanation.
Well, I could not agree more, because we are, as a company, rolling 90% of our profits back to R&D. And at the end of the day, we're looking at another company that literally trademarked a word. They don't actually have an active ingredient that is special. They trademarked a word, and they are spamming it within their in their every product, and kind of selling the story of that trademarked, ingredient that doesn't exist, by the way. Like, if you go back, what is it? Oh, it's our approach on this, whatever. So I completely understand it. I think in our field, at least someone could argue that there is a 30% that is placebo, that if they convince you something good, at least you have 30% of it that benefits you. In your field, you don't even have that. So the question is,
but in your field, at least if you get a cream, maybe it's not going to be the best cream, but it's if you just put any oil on your skin, it could do something. You put coconut oil, olive oil, right? There's something that's going to happen. I'm not saying, that's not the best products necessarily, but you put something on your skin, there's probably going to be a positive change. Just any of
anything is better than nothing. Yeah.
In this field, it doesn't work like that, right? It's not the difference of buying a Mercedes and a Honda. It's the difference of buying complete garbage. It's worthless. It's not only worthless, but it's going to harm you by following the wrong stuff, potentially, to something that is really very sophisticated. And so it's now become my mission to try to educate people on this. And it's it's so hard because you have all these other companies who have the opposite incentive, right? Where they're just trying to sell. Yeah.
Okay. So I do have a question about that. And I want to make sure that listeners are following my train of thought. So you did mention SNPs. So we have, millions of genetic variants and genetic SNPs, genetic series of letters that differentiate different functions. And obviously, the more of them you look at, the better picture you're getting about someone's health. Understanding that for interacting with Self Decode can go in two different avenues. I can, upload in case they let me, my 23andMe data into your program, or I can get my genetic sequence, my genes sequenced through you guys. Why wouldn't another company just look at more SNPs? Like, since you guys are not saying, hey, we have the only patented form of gene sequencing, what prevents another company from doing what you're doing?
I'll explain. So it's actually extremely complex, and no other company has the technology on the consumer, not 23andMe. 23andMe is actually a lot better than a lot of these other companies, meaning if you look at some of the reports, like I remember looking at their diabetes report or whatever, they're looking at 1,000, 1,600 SNPs. And because they have a very large population, they're able to validate that with less SNPs.
Yeah.
So that at least is a valid product, I would say. It's not a scam. You can argue that it's not useful, but meaning like they're not giving you any recommendations. I mean, maybe it's somewhat useful.
But how many percent of your DNA is from Neanderthals, which you could go ahead and
right, exactly. So you'll get the percentage of your DNA from Neanderthals, but they're not. It's not a precision health company, right?
Yeah.
But at least it's a valid company, meaning what they're telling you they're doing, it's more likely to be true than not true, and that's not a scam all of a sudden. Whereas these other companies, you cannot say that. It's actually a 50-50 toss, whether it's true or whatever they're saying. Yeah, it's literally just garbage information. You might as well just get a random number generator, essentially.
Mm-hmm. It's a muscle testing from the jug behind your
what it is.
Your body.
Exactly. No, it's exactly what it is. And just like the FDA and I don't like regulatory bodies very much, but just like a regulatory body doesn't control whether a physician could do muscle testing, they don't control whether somebody can sequence certain SNPs and tell them, give them information based on that. And I think that's good. But then you have to make sure that there's people who educate on what is a scam and what's not, because you have the Wild West now. Whenever you don't have the FDA involved, you have the Wild West. And I personally prefer the Wild West than something heavily regulated, but you see the issues. I see the issues with having the Wild West. The benefit of the Wild West is, people can bring things quicker to the market. They don't have to get saddled with regulations. There's benefits to that, and consumers can make choices. Whereas, the healthcare system is so expensive in part because it has to go, if things have to go through FDA approval, it's way more expensive. But so there's no regulatory bodies, and it's a very complex area. It's just ripe for scams, right? Yeah. It's just like whoever can sell better is the winner. That's how it is in this industry, unfortunately. But no matter what, I just can't. It's not in my DNA to sell shit. And so if I know that I'm selling shit, I'm not comfortable with that. And maybe some of these companies don't know they're selling shit. I'm not saying that they're purposely scamming people. I just think some people don't really. These people who are starting these companies they're not geneticists or population genetics, genomicists, which is the area that you need population genetics. So they're not experts in this area. They're just, any monkey could find some SNPs on PubMed and say, I've got this report. Here's some recommendations. And how does anybody know that this is not accurate? It's not possible. It's just,
Got it.
and that's what literally happens.
But what I like, I understand completely, but what I like, I think what really, I believe is one of the differentiators of Self Decode or a couple, first of all, is the cross-referencing to blood testing. I think it is, I mean, to be honest, I don't want to take anyone's job, but these two things together are basically your functional medicine doctor, $700 appointment. That's what it is. And then on top of it, what you don't get normally in this $700 plus appointment with your functional medicine doctor is your very, very, very extensive questionnaire that basically is as extensive as the person kind of wants to go through. So I am very curious as to the decision or the decisions that drive you to combine these tools, and how do you look at the combination of them?
Yeah, so I knew early on that we needed to combine tools. If you just have one thing, it's unfortunately not very accurate. Meaning, I studied the body for a long time, I still do, and I just realized it's too multi-dimensional. So if you just say, you have this SNP, the way the current these companies currently work, you have this SNP, we're going to give you this recommendation. That is like the worst way you can do it. It's just completely not legitimate. So, and then another way is, okay, you have this genetic predisposition, we'll give you a recommendation to prevent heart disease because you maybe have higher risk of heart disease. Okay, that's more legitimate, by the way, but still, now you have 500 different genetic predispositions. A third of the, let's say 20% of them are going to be high risk. So you have 100 high risks. You're going to take a supplement for every risk now? No, it doesn't make sense. Mm-hmm. Now you're going to bring in a lab test. I get 300 lab tests done. I don't see anybody. Like out of anybody's lab tests I've seen, mine are actually the most optimal. But I don't see anybody, like people who think their labs are optimal. I look at it, I'm just like, 20%, it depends who, but like a very large number are not optimal. So you're not going to take every recommendation for every lab. Now you might have different symptoms, different conditions, different goals, different risks from your lifestyle. It just does not make sense to take a recommendation for every test that you take. It becomes, and so the more I knew, the more I realized of like, okay, well, I think I should take this supplement, but how many reasons do I really have to take this thing, right? Like, I can't just, literally, I would be taking 1,000 supplements because there's a reason to take everything. I can find a reason to take everything, to do everything. Right. I can find a reason to do every lifestyle thing, to take every supplement. It's just not feasible. So what I started to do for myself was build up a 200-page document that everything I did, I would give every dimension of why I did it. Because what would happen over time, I would realize this, I would start on a supplement and then I would stop taking it. And I was thinking, why am I stopping to take it? And I realized because I would forget why I'm even starting it to begin with. Mm-hmm. It's like, it
became less sexy over time.
Yeah, it becomes less sexy. You hear some podcast about it. It's like, somebody's saying this thing is going to cure everything in the world. I got to take this supplement. And then I start taking it. And then 30 days later, I'm like, why am I taking this thing again? Right. And so then I would just stop. And then, and so that was like, for a while I was just doing that. I was just starting, stopping. And I wasn't even, it's like, there were reasons. And then I just would forget the reasons. And then it was very, very inconsistent with my whole routine because of that. And so at a certain point, I realized once I started this much more data-driven, I took it to the next level. I've been data-driven for a long time, but I just said, okay, this is going to the next level. I started making a list of everything I do, like every single reason that I've ever come across why I'm doing it. Every clinical trial and every reason why I shouldn't do it. Because I don't want to just see like one negative and then, that's it. I'm stopping because of this one negative, whatever. Mm-hmm. And so I just kept on building.
Do you mean like reason, like mental reason, or do you mean like, Again, you have a love story with niacin and niacinamide. So, blood sugar levels and bone density. Like, what is the
that would be a good.
What do you mean by negative?
So niacin has negatives. I can name about 10 in my spreadsheet, and on the Self Decode site, you can see different negatives of niacin, right? Yeah. But it has way more positives for me than negatives. And for me, it just becomes the dosing what's the optimal dosing for me. But the way I used to think about it is I would read some negative and just stop taking something. Like, oh, this thing, carnitine or choline, increases TMAO, and now that's it. Never taking carnitine and choline again. You know what I'm saying? Like, oh, I didn't know this, and just stop. Boom. And I'm just yo-yoing. I hear some podcast. I'm like, yeah, I got to take this thing. And I start.
Yeah, I got to take a bucket full of melatonin now. Oh, no.
Exactly.
No.
Oh, wow. Now they're finding out that it shrinks your gonads. Forget about it. I'm done with melatonin. Stay away from it. I was taking 5-HTP and Huberman is like, oh, this kills your dopamine. I'm like, oh, that's it. It's done. And then like curcumin, he's like, oh, wow, it's going to kill your DHT. I stopped taking it, whatever. So I can tell you can name any supplement. I'll tell you a reason not to take it. I can also tell you a lot of reasons to take it. And so I was just finding myself being very inconsistent, which I think was worsening my results. Definitely was in hindsight. And so I said, I need to just be very, very data driven now, even more than before. Like really track everything I'm doing and list every single reason why I'm doing it. And so I started doing that, and I've been very consistent ever since then. I haven't yo-yoed. Somebody comes out with something, okay, there's a new study on niacin now, it's going to kill you from cardiovascular disease. I add it to my sheet, okay, we add it to Self Decode. I tell the team, okay, hey, look, or, we find different things, we add it to the website to make it more sophisticated.
Yeah.
But the idea is that it doesn't change the equation. It's like, okay, this is a data point. Very good to know, noted. But because I have such a sophisticated multi-dimensional way of looking at why I'm doing things, there's not one thing that you're going to tell me that's just going to convince me one way or the other.
So let me ask you, for the most part, do you feel like you're, in a perfect world where someone had also, let's say they live in the US, because I know that the lab tests that you guys interact with are only US, right?
Yeah.
Okay,
well, the genetic test is global, but yeah.
Yes, genetic test is global, but I'm saying if someone was, the perfect participant, had their labs, and did the genetic tests, do you feel like the labs... Yeah, go ahead.
To be clear, you can upload it from anywhere in the world.
Yes,
lab tests. I mean, you don't have to buy them from us, but we also sell them in the US.
Fantastic. So, you know what? For my example, let's say they had all the correct lab tests. Doesn't really matter where from. They uploaded them to Self Decode. They did the genetic testing. They uploaded it to Self Decode, and they did all the questionnaire. Do you look at it as the lab work as the most immediate read on where the person is at, and then the genetic testing as the best way to kind of hypothesize what is going to help them? How do you look at it exactly?
So I'll explain how the algorithm works and what are all the data points that we look at. So there's 6 different data points that we look at. One is the most basic, your symptoms, conditions. What are you dealing with, right? And in that dimension, if you have multiple symptoms and conditions, which most people have, some very healthy people don't, but most people have some, and these could be things like acne. It's a symptom, it's a condition. It's, it doesn't have to be deadly or anything. Could be brain fog or whatever it is, right? Chronic fatigue or any kind of symptom condition. So that's number one, is you fill out a list of your symptoms, conditions, and now we have the largest database of showing, we could show you a best fit just based on your symptoms and conditions. The next dimension is your goals. So those are things that, they're not problems, but they're things you want to improve. Maybe you want more energy, you want to improve your mood, you want to whatever your goals are, right? Skin health is a goal.
Yeah.
So you pick what your goals are, and that's another dimension. Next, the reason why genetics is so important is because we could look at 500 different risks using these polygenic risk scores, looking at 1 million variants, sometimes 2 million, sometimes 100,000, whatever the model is. But we can figure out tons of data, tons of these genetic risks, and then see what are the risks that you have. Like I said, this at a given person, you're going to have 100 out of 500. So we can see what the risks you have. And each risk is given a different coefficient of weight, meaning like if you're at risk for cardiovascular disease, that's 50% of people die from that, right?
Yeah.
That's going to be more important than if you are at risk for, having a foot fungus or something.
Yeah.
So we give coefficients to all these things. And then the labs we give coefficients to. Each lab is different importance. So we give those coefficients. And then we also have lifestyle risks. These are questionnaires that you fill out. So things like, do you smoke? Do you drink? Do your parents have this condition or that? How did you grow up? And this, that, and the other. Do you live next to a coal plant?
How many hours you spend on X getting upset at other people?
Exactly. How's your sleep and things like that. And so that's that's not a lab. It's not a genetic risk. It's a lifestyle risk.
Mm-hmm.
And it's not a symptom or a condition. So we look at all these factors. Those are 5. And then we also look at specific genetic variants to kind of give a little bit of more weight. Each recommendation for each report has an impact and evidence. And so that also helps guide for each report what the weighting is. So now you can understand how multidimensional this is compared to what these other companies are doing is like, you have this SNP, therefore you need to take this recommendation. And that's Rhonda Patrick, right? And she, I would say, is a credible person with a shitty product, right? She's a very credible person, but her product is literally that. You mentioned that you did the test. I'm sorry to hear, right? It's like, you can attest to this. Like, you have this SNP, you need to take this supplement, right? That is garbage.
It is, and it also is very, it is extremely wishful thinking because you are not getting any real-time data. The problem I feel like with taking something like a genetic test in a vacuum is the lack of real-time reads that can be revisited. I feel like that might be the most important thing. You mentioned, and that's what's kind of charming in Self Decode, kind of led by you as a person, is it's not, I did this 15 years ago, this is what I found, and this is now my mantra for the rest of my life. This is my religion now, taking, sea moss or whatever, your mantra is, test, adjust, retest, etc. So I think as important as having a robust, all-inclusive genetic testing is a pathway in which you can adjust your lifestyle and retest for results.
Exactly. And that gets to it, meaning like that's another factor we use. For example, I always tell people, upload as many labs as you can, because the more labs, the more data you give it, the better the recommendations are going to be. I have 12 years of lab data on the platform, and I've just been figuring out so many things I would never be able to figure out if it wasn't. In the past year, I took 7 lab tests 17 times.
Wow.
And every time I take it, the recommendations get better. I learn more. That's why I'm doing it. I would have never done it if I didn't have the software. I could not make sense of it, right? It's just, I'm going to look at 17 PDFs with 250 markers each, figure out what was what, when, and this is this level. It would take me years, right? So
well, to your point, there are markers, but probably genetic markers are more stark in that comparison I'm going to do, but there are markers in which the paradigm of what they do and the interaction with other markers have changed since the first time you took a lab test or a genetic test. You talked recently about the warrior/worrier gene, and I mean, 15 years ago, it was really considered that one gene could determine, a characteristic that you walk with for your entire life. And we know today it is extremely more complicated, and that it might even be in reverse, I would say, as far as what you think would benefit you.
Yeah, exactly. So it's that the more data I got, the more lab tests. And by the way, when you have a lab test that is previously suboptimal, that also gets, now, even if it's suboptimal now, you probably did something, you still want to, do things to prevent it from being suboptimal in the future. Mm-hmm. There's suboptimal, there's out of the normal range. And so the reason I've done lab tests 17 times in the past year is because of the results I'm getting from it, right? I don't like just pricking my, my hand, and, it's expensive. It's because I think it's so valuable. And I mean, it's such a game changer. Like,
it is.
I can give you specific examples of what's been game changers. But just overall, people are not going to be able to compute. I think people like specific examples, but they're still not going to be able to compute the final result of what they need to do without sophisticated software using AI, machine learning, things like that.
So let's get into skin health as a end goal. Let's say someone, again, we do have many people that listen to this podcast because they believe that we have good general information, but we do have people that this is their address for, hey, I'm listening to this to improve my skin. So how do we take a test and, what are some adjustments that we're going to get, or, what are some snips that are going to be looked at, or what are some adjustments that are going to be recommended in order to improve skin health?
So you can filter the recommendations by a specific category. And there's a category called skin and beauty. And so it'll filter those recommendations based on that. We have topical recommendations as well. So you could filter it based on topical recommendations. For skin health, you need a combination of external things like creams and things that you do internally. I'm a very big fan of the internal part. And I figured out things that I was deficient on that very much help skin health. And I know that I was deficient on based on my lab testing. Without the lab testing, I would not have known, right? It's not something, I'll give you an example of two things that I tried before the lab testing that didn't work based on just doing a megadosing experiment. So niacin, you feel like something's, you're in hell or something. Your skin is burning up and you're like, this is not right for me, right? Like something's wrong here. And you see warnings online. So you can't just figure out everything from a megadosing experiment. But I looked at my labs and I was able to see that I needed more niacin. It was very clear based on my lab tests. And then, by the way, it's also clear when I was taking too much. So that's why I basically like to push things to the limit and see, okay, if I do this, if I do that, what is the effect? And so niacin, by the way, is extremely good for skin health. Extremely good. I was also deficient on AKG, which is extremely good for skin health. And you could also figure that out with lab tests. That's a supplement. And it's also a skincare product.
Yeah, the skincare product is not as effective as AKG as a supplement. The effects of AKG, more ATP, etc., could be there are other ingredients that are really good for skin health within that aspect. But AKG is incredible as a supplement. Do you have any opinion, by the way, just as a caveat, as far as calcium AKG, slow release? Yes, no. Did you see any data supporting one or the other?
Yeah. So, and just to comment on your comment, I don't know how good I don't personally take AKG topically, right?
Yeah.
maybe I should, I don't know. It's just I take it internally because I think if you got enough internally, you'll get it enough on all over your body. But in terms of the forms of AKG, I don't think it makes a difference, right? It just depends on what you need. There's three main forms that are sold: calcium AKG, arginine AKG, and ornithine AKG. And it really depends on what you need out of those three. Do you want calcium in AKG? Do you want arginine in AKG? Or do you want ornithine in AKG? For me, I can buy cheap calcium supplements and get calcium, whereas the calcium AKG supplements are more expensive.
Yeah.
And so, and the arginine AKG is the cheapest, and I need more arginine, so I just go for that.
Yeah. I mean, that's it's funny how this bodybuilder supplement that was for years, only consumed by the bodybuilding community is now like a health product for everyone. I think that's why the arginine version is the cheapest, just because it is so wildly and widely used within the bodybuilding community, right?
Yeah, and an interesting thing, by the way, for me, when I look at my recommendations, AKG comes up very high, surprisingly. And it's like it's not something that normally, like a lot of the supplements that come up high are things that you might have heard of, but once in a while you'll get things that are like, whoa, why? And because I know my body very well, I know, well, this is actually really good news because I do really well on this, and it figured out that I needed this AKG, where like it took me 10 years to figure out that I needed it, right?
Yeah.
Whereas this is telling me pretty quickly.
So yeah, for sure. So Joe, what I'm interested in, the omics sciences as a whole are exploding now as far as research, at least much more than they were before. When you say about like fine-tuning the software, fine-tuning the offering, are you looking at other omics sciences, genomics, proteomics, metabolomics, etc., to weave into Self Decode? Do you feel like you got everything covered by labs and genetics, and now it's just inputting more research? How do you look at it?
So we would break up the omics by the type of omics. And first of all, metabolomics you can upload, right? When I say labs, I'm actually including metabolomics as well. And so you can upload any metabolomic biomarker, and that would be a lab as well. A good example of that is I upload amino acids, which are basically metabolomics, and I just consider that lab. So I think it's just a terminology there.
Okay.
You have epigenetics, and epigenetics at this point, I would say True Diagnostic is the most credible company in the space, and from my knowledge, and they have a hard time giving specific recommendations for what you need to do. So what we look at, we get some questions of like, why don't you include a lot of wearables and trackers? The answer is because you can actually get a lot more data just asking somebody, do you sleep well?
Yeah.
What is your HRV on average? And, it takes a second to fill that out rather than like, I'm going to connect with this tracker and try to figure out what's going on. We can get just as good data or better data by somebody just telling us what their sleep is like, the quality or length or whatever it is. And for the epigenetics, I think it's a useful test for a specific purpose. What I like about the True Diagnostic test, it's an area under the curve test, meaning I can look at somebody's lab tests and see if you're healthy and how healthy. Like I can be like, okay, this person's super healthy. Like, wow, very impressed, super healthy, or this person's a complete train wreck. And I've told people both things, and most people fall in the middle, but I'm very blunt. So I was like to one guy, hey, look, you're a train wreck. I don't know any other way to
as someone said on TV, call an ambulance, but not for me.
And he actually, the funny thing is, I mean, it's not funny, but he took a cardiovascular test, and he took like an EKG, and the cardiovascular doctor, cardiologist was like, hey, we might need to do surgery on you this week. I mean, like,
oh my God.
In the end, they didn't need to do surgery. So good story there. But the point is that I just looked at his blood test. I'm like, you're a ticking time bomb. And if he would have went to a doctor, by the way, the doctor would have said he's fine. He's very healthy. Just to be clear, if he would have went to a normal doctor, the doctor would have just been like, oh, you're fine. Yeah, nothing. Meaning based on what the results the tests that they normally give. And so when I look at the test, it's very different. But in any case, I can see the wide gamut of health. And so, but the epigenetic test is really good at giving you like one score and saying like, oh, your pace of aging is this. I think it's good from a marketing perspective. Like one person can compare their results to someone else. So, now it's kind of gaining some traction based on Brian Johnson by him saying, hey, look, I've got this very low rate of aging, but now people are beating him, right? Like me, there's people like Simland. And so, but it's a way he can be like, hey, look, I have the healthiest thing out there, but what are you going to look at all 250 of his lab tests over time? It's very hard to compute that. I can look at it, but regular people are not going to do that. And he's not going to show them to me necessarily, right? So this is kind of like an easy way to see like how healthy you are, or instead of necessarily needing to see, but you need to see all your specific labs to understand actually how to become healthy.
Yeah.
So that's where I see the epigenetics. What other metabolomics are you referring to that I missed?
Well, first of all, what I was referring to mainly was metabolomics.
The microbiome.
Because microbiome, yeah. Microbiome, I don't think that there is any test on the market that necessarily is
worth its salt.
Good.
We're on the same
or
page there, by
sincere.
The way. Yeah.
So it's. I don't think that this is a science that necessarily is growing in leaps and bounds. So I wouldn't even suggest that anyone look at it. You better look at inside your toilet if you were interested in that. But metabolomics, I feel like, is probably the field that is going to explode the most, and that is just sensitivity. That is just the ability to infer data, and obviously, more larger data sets that companies can look at. That obviously is one, and I think the ability. Obviously, there is a test to measure the Horvath clock and things like that, which again would give you I would just look at it as a kind of insurance policy to make sure that you're doing the right thing, but on a very large time arc where you would look at it, 2 years in a span of 2 years or 5 years. I think if you're looking at it in too close of time frames, what you're looking at is, I'll give you an example. So they measured, obviously, the effect on the Horvath clock by taking exogenous human growth hormone, and they measured, reduction of 6 months in the biological age, which I hate that word, of the people who took. There is no such thing as the people who took the test. But what that tells you is that it's not that you actually reduced. It's not like you reversed the rate of aging, which you mentioned the word. That is the word to use, the rate of aging. You did not reverse the rate of aging. It's devoid of your rate of aging. Your rate of aging is what it is, and you've allowed your body to go back and correct some of the mistakes that you looked at under the flashlight of parameters that you looked at. So I think it's very difficult to tell you, I think you should incorporate this or that. Maybe 120-day omega-3 blood panel, but other than that, I don't know what other tests you would incorporate. No, I was more wondering. Yeah, go ahead.
No, we're on the same page. I actually agree with all your opinions. I think microbiome is up and coming right now. All the tests I've used were garbage. Maybe there's tests out there that I don't know about.
Well, talking about, I think one of the worst things that you're going to do, even if there was a good test, is only test it once and go by these recommendations, assuming that there is a good test. I mean, one of the key points of microbiome is diversity. So if you are going to try and, go through one recommendation for the rest of your life, you're very quickly are going to cause more damage than good.
Yeah, exactly. I think you want to get reproducibility.
Yeah.
So we're on the same page there. I'm very excited about metabolomics, which, by the way, is incorporated into what we're doing. I feel like it needs a little bit more evidence, but I'm starting to see more good studies, and especially the amino acids. That's why I've been super into getting tested with the amino acids. We have all those on Self Decode. I look at them within Self Decode. So I think, and as time goes on and we get more data on these metabolomics, I'm going to be doing more of these tests and seeing what makes sense, what we can add, what has recommendations. We're not going to necessarily focus on things that you can't get recommendations from, because the idea is that you want data that you can improve the decision making. And so I think we're on the same page there.
Yeah, I think just to touch, that's great. Just to touch on, amino acids is a subset of metabolomics, and metabolomics as a whole. Part of the issue is, even if you're growing your data sets, you are still lagging a few steps behind as far as interventions, right? Like you're lagging in data sets of, okay, what do I do now? Whereas, for example, let's just take the lowest hanging fruit, which is like the motherfucker gene, for example. This is obviously how well you methylate folic acid, folate. That is something you can very easily just go ahead and supplement to correct, or to supplement for your deficiency. Whereas something much more complex like metabolomics, like testing different versions of chemicals in your body and how prevalent they are, it is a much harder journey to go ahead and affect them over time.
Yeah, I mean, but I think the reason why I like the amino acids is because you can affect them, and I proved that for myself. Meaning, like, it wasn't 100% clear to me. I mean, you can get ideas from the research that you can increase a lot of amino acids, but not necessarily every one. But I basically proved to myself that you can actually increase all of them, almost all of them. I'm still trying to see exactly which ones, but it's very interesting to see it was super useful for the whole amino acids. I mean, I can talk about this if you want, but the amino acid tests were like a game changer for me. And I mean, I was deficient on a bunch of amino acids, and I have a very high protein diet. And so I started supplementing with those amino acids, and there's been a very good change.
Would you even try and explain or try to get to the root of why you were deficient? Can we correlate it to another set of either like lifestyle choices and or like genetic predispositions? Or are you saying, hey, that's what I'm dealing with right now, let me just take, Lucy?
No, it's all connected. It's all connected. Yeah. So if you have a predisposition for, certain tendon injuries, there's probably some genetic variants that it's finding that maybe you're not as good as creating collagen or something like that, right? And again, so all these things are connected in some way or another. But, I also look at things individually sometimes, like with the lab test. And for me, all the, so AKG actually is turned into different amino acids in the body.
Yeah.
It's turned into glutamate, and different amino acids actually I think they interconvert into each other. But basically, if you have enough AKG, you should have enough proline, arginine, and histidine. And I had low levels of all of these, right?
Wow.
So that means I needed more AKG, and then I also supplemented with more histidine, arginine, and proline. And the funny thing is that I did all these experiments individually, and I didn't like I took a megadose and I didn't like the results. But what I learned in hindsight is when you get a very strong reaction sometimes from something, that could also be a good thing. It means that your body is like kind of shocked it was missing it for a while. And now it's like because you have it, there's a stronger reaction to it. And so in hindsight, that's what it was. And I took all these things separately in megadoses. I've done, megadosing on proline, on histidine and arginine different times. And I was like, I don't think so. And it turns out that now I take it and I take it on a consistent basis and I notice good changes and I see the levels improving in my blood. And this is exactly a kind of area that you couldn't megadose. You would get a different conclusion. Same with the niacin, same with a whole bunch of other. So there was like, I gained so much from megadosing, but I hit a plateau. It was like I wasn't really making a lot of progress after that until Self Decode got to a certain level of advance, meaning like, at different time periods, I was always getting information, which was, kind of adding to my knowledge of things and was improving. But it got to a certain level of advance that it started to have more exponential progress of figuring out what's going on. And I was just like, starting to make all these connections and figuring out how to strengthen my immune system and basically go from above average healthy to the healthiest person that I know, that I've ever seen blood tests for. So I go on this India program, this IWO India program. I go with some people. You should actually come some point. And the reason I do that is because, first of all, it's a great place to meet people, but also it's a unique opportunity to like take tons of testing. I went there, just came back a week ago. I went there for 10 days. I took 3 of these 250 biomarker tests, VO2 max, DEXA scan, treatments, great food, like just the whole shebang, just focusing on the testing. And I could see exactly how things are working when my body's fighting infection and what I need more of. And it's just incredible. It's just absolute. And then I am also looking at everyone else's blood tests, and I could see like there's just so much that I could learn from it. And it now I feel like it's such a superpower because I look at people and they're like, when they're not using this, sophisticated software, I'm like, some of these people are in the Stone Ages here now, right?
Yeah. I think it's what you're saying is even more true when someone does not have the bandwidth in their life to take into account 250 biomarkers. You know what I'm saying? Like it is incredible to someone such as yourself that would literally be able to, instead of having an algorithm do it, be able to go ahead and decipher everything themselves. But if you are someone that this is not their first passion, it's their third or fourth passion, let's say again, someone does it because they are interested at the end of the day, not to look more wrinkly and not to have sarcopenia and to not, in air quote, look like my parents when I'm their age, You have to have a program that does the most for you, that gives you a read and a laundry list of things that you should do in order to live somewhat optimally. I mean, it is the chicken and the egg. Like you need to be interested in living optimally and try to educate yourself. But at the end of the day, that's not your first job. So you got to go through a program that does it for you.
Absolutely. And it is my first job. So,
yes.
I'm actually like, I could do quite a lot by, and I spend a lot of time looking at my markers mainly to be able to understand what other people, like how do we make self-decode better so that other people don't have to do this? So I'm constantly looking at my results and being like, okay, how do we make this better? How do we integrate this into self-decode? Like you said, metabolomics. That's what I'm looking into that for myself so that we know we're on the cutting edge. We say, okay, let's integrate all these metabolomics, because I started seeing a lot of studies where it shows if you have this marker that's elevated, either you'll live longer or less long. And the idea is that you want to get every marker. I mean, you want to look at many things. Number one is you don't want to have any symptoms or conditions. You want to feel great and meet all of your goals. You want to have a good mood all the time. Like I really set very, very high standards for myself. Like my standard, my standard for, let's say, mood used to be like, okay, I don't want to be like in a depression, right? Now it's like, I don't want to ever be anxious or ever be in a bad mood. That is my standard, right? It's like, I never want to be in a bad mood. And when I'm around people and I look at them and they look at me like, what do you mean? But everybody's always like anxious sometimes, or, they get into bad moods. I'm like, no, that's not my standard, right? I have a different standard here. I don't want to ever have bad skin. I don't want to ever get a pimple. I don't want to ever get sick. So, well, everybody gets sick, so I want to have unlimited energy. Like I set very, very high standards, which is crazy because at one point I had the worst health of anyone I knew. I was the only guy I knew that was disabled from my high school, right? Or from, it's like everybody else was just, they're doing their thing. They're married, the kids, they're in relationships, they're going to school, they got a job. I'm like disabled. And I'm like, I literally, and you think like, oh, am I ever going to get past this? You don't know. And I got into like Zen at a certain point. I'm like, I'm just going to accept my reality. I was like, this is a really shitty reality, but I was like, okay, I'll just accept it. But then I just started figuring out all these ways. And so there was these different breakthroughs, but this data breakthrough is just, that's why I'm so passionate about it, is because like and I speak to some of these doctors and I'm just like, these guys are using like Stone Age tools here, right? And it's like, and now I'm, I like, if you can ask me any marker and I'll tell you offhand what the optimal range is. I know recommendations. I can look at somebody's blood. You go to a doctor, they don't even know I go to like different doctors, like, what is this? Oh, I got to look at the reference range of the lab. I have like all these numbers. I know, like I have all this information in my head, but I use the software all the time to make it me even smarter. And so I'm really passionate that I think the amount of data we have and the tools, we can really do things that are unbelievable. People have no idea.
Incredible. Listen, man, I could talk to you for hours. We are supposed to keep it under an hour. That's already an hour and 20 minutes later. So I want to thank you, Joe, very much for coming on. I am pretty excited to hear from people. So a lot of people have been asking us what tests they should use, etc. So I'm very excited to see the results that people get. And I highly recommend, obviously, going to Self Decode, figure out what tests you can take, depends on where you are and what you can upload, what you already have. And we're going to do the same. Anastasia and we're going to do the same, and we're going to update people with our results. So looking forward to it. Maybe we can do like, go ahead.
Yeah, just to tell you how I would go about that. So when you go on the site, it's going to ask you for their symptoms, conditions, and goals, right? So that's one thing. You want to fill out as many questionnaires as you can, and you want to get the genetic test. It's going to give you a lot of data. So you get these things. When you get the genetic test, it's actually going to tell you which lab test to get based on your genetics. So it predicts, it's a suggested labs feature. It basically says, well, let's say you have a high genetic risk for ApoB, which I have, okay? It's going to tell you, go check your ApoB. So it just gives you very concrete results. Here is what you need. Okay, go check this thing. So I do have high ApoB levels unless I do something about that. And so it's able to predict, and and there's one thing that there's a prediction. There's a lot of other factors. So you still always want to make sure you want to test as much as you can. And so it gives you the suggested labs to do. And again, if you're in the US, you could do one click. It creates a whole panel that you could go buy, or you could go get it somewhere else, your doctor, wherever you get it from. And my recommendation is, one of the game changers is to upload as many labs as you can. And the reason that helped me so much is because I was able to see the trends over time. Even though I'm a savant for numbers to a certain degree, I just can't remember what my, you know, my white blood cell was exactly, my neutrophil count was in June 2012. And how that curve goes over time, like I can never do it. Whereas it gives you the graph over time, and then all of a sudden I look at that, I'm like, holy shit, here's what's happening. So it allows me to make sense of what's going on. And so yeah, ever since now, I'm just like in this, you know, I feel like it's like I can do, you know, what's the next for me? I'm really pushing my own boundaries as a person, and it's great. I'm really like, I'm really grateful that I've gone on this health journey, rather than in some other industry where I wouldn't have been able to make these same innovations.
Yeah, I couldn't agree more. I think you know, I had a business partner who said there are two types of people. There are people who like fishing, so they become a fisherman, and people who like fishing, so they make so much money they can retire and go fishing. I mean, that's your two options if you like fishing. And surprisingly, the first type of people are normally happier. The fortune of the health industry is that you can kind of do both. You could become successful and live in the environment that you're interested in. And I know exactly what you're talking about, because I feel very grateful to be able to do that. You know, if I was interested in, I don't know, paper mache, which I am absolutely not, it wouldn't be something that I could make. I don't know. Can you? I don't know. Maybe you can. I would make a career out of it. So I completely understand, and I'm very excited to see where the future takes you, where it takes us. Very, very inspiring. I thank you so much for taking that road, because your product is extremely exciting, and I'm very excited to use it myself. So
awesome. Appreciate it. And hopefully I'll also get you on my podcast, and we could talk about, you know, different. I want to know what's the scams in the skincare industry.
Oh, that's, I don't know. Book 3 hours and we'll get into it.
How much
for
time
sure.
do I have?
Exactly. But it's the same like every industry that we are, you know, same thing you talked about, regulation in the United States, specifically in the world as a whole, is is basically, you know, regulation under the flashlight, the flashlight. If you are, you know, dealing with peptides right now, then regulation is definitely something you should be engaged in skincare, in genetic testing, in you know, meat, in supplements. It doesn't exist. It is a you know, it's a
Wild West.
ribbon participation trophy. You know,
I got it.
So yeah. Anyway, Joe, thank you very much. It was incredible, and I hope to talk to you soon again.
Awesome. Thanks for having me.